Good morning, one and all seated here. I take this opportunity to thank the management for having invited us here. And to start with, me and ma'am come from hospital setup. So we see everyday patients and nurses struggling, patients struggling for their life, and nurses struggling for their work to be done. And day in, day out, we see all the struggles of patient and nurses. And as an organization, our responsibility will be to take care of the patient, and utmost concern is patient safety and quality. We don't want to harm the patient, and we want to make the patient ensure that he goes well treated to the home. And in other turn, our nurses, nowadays we are seeing our nurses, there are some lacking because last 2 years we didn't have any education, and we had only online system of education where you studied on your own and you passed. Though online classes were happening, it just helped us only the theory part but not the practical part. We have not touched the patients, we have not seen the patient, we have not done any procedure to the patient, and just like that we enter into the system. And the difficulties faced by the organization is our nurses, they lack communication, they don't talk to the patient, and the important thing is lacking in practical skills, which is very essential. Yes or no? Yes. And one more thing is that in the previous days, when we go to the patient bedside, we talk, we share our feelings with the patient. Patient also in turn, they share their feelings. Okay, but nowadays what happened is the nurse go to the bedside, she just meddle with the work, what I am supposed to do, I have to give the medicines, she will load the medicine, she never talks. She just gives, just like a robot. So what happens is there is a distance between the patient and the nurse. Yes? So one main thing is what I want all of you to know is when you are coming out of your education, come out with robust knowledge. Yes? Robust knowledge in the field of your education, that is in nursing. Having very little knowledge and no knowledge is dangerous for patient's life. Yes or no? Yes. So one thing is come out with good knowledge, and I want all of you to practice compassion. What is compassion? We keep hearing the words compassion, right? This is very essential for our nurses. What is that? Anyone little louder? Little louder. Kindness? Okay. Compassion is having sympathy or a pity. You need not show pity to the patient, but you have to be sympathizing to the patient. And at the same time, our nursing tells us to be empathetic, to be one more step forward, to be in their place and understand the pain and the fear. Yes or no? Yes? Okay. So I want all of you to practice that compassion. One example I'll give you. For example, you are a nurse. You go to the patient bedside. You take 5-6 patients assignment, right? But one patient is telling that he is having so much worries about the family. If I undergo surgery, I am the breadwinner of the family. Who will take care of my family? Who will take care of my kids? He will start crying once you start talking to him. What is your role during that time? What will you do as a nurse? Console? Okay. You need not even talk. Just stand there, hold their hand for a few minutes, and you give that compassion care. Tell them that you are there to take care of the patient. When you are having that compassion and communication with the patient will be free of their mental tension, and physically also they will be little with ease so that they get healed quickly and go home back to their families. Okay, maybe on that day in your particular shift, you may be delayed in doing your charting or your documentation. Maybe you're delayed maybe by half an hour. That's okay. But you have spared your time to the patient. Yes? So I want all of you to practice that compassion in you. It should come from within. It's not that I teach or books teach. It should come from within. Being a nurse, we have chosen this profession to serve the patients. Yes? Yes. So please follow compassion in your life. And one more main thing is communication. All of us know mother tongue. Yes? You know English. Now you are out of your state. Yes, so what is your responsibility? What's your responsibility? Learn languages. Learning a different language will not harm you. Understood? So learn different languages, which will be an added support for you when you're at the patient bedside. You know Tamil, you know Telugu, you know English, you know Malayalam, you know Hindi. You can tackle any number of patients. But I know only Bengali, sister. I don't know any other language. It's very difficult. I'm just giving an example. Understood? So learn your languages. Be compassionate to your patients. And one more thing is about tech savvy. Why I want to tell you this is, nowadays all of us are in Instagram. How many of you are in Instagram? All. And Facebook? Okay. Now I'll ask you, how many of you know Excel? How many of you know to create a PowerPoint? No one knows? So we have lot of resources to learn by ourselves. Now Google is in our hands. So do not waste your young age. Whenever you're free, apart from your studies, learn multiple languages, learn the computer basics, okay? Because now when you come out of a graduation school, you're into a hospital. Once you get practiced, you become a nurse, you grow from staff nurse to a senior nurse to you become a CNO also, right? So you need to know how to present your analysis, how to present your data to the top management. Yes or no? These are too far for you, but still don't waste your time in your young age. Yes? So only this I want to tell. And one positive thing about nursing, thing is, there is a huge demand for nurses. All of us know, right? Huge demand, very huge demand. So study properly, learn your basics, and WHO states that we need 4.3 million nurses by the year 2024. Okay? And the ratio of nursing is to patient is, it is 1:7 what we are right now, but WHO states that 1:3 is sufficient. But we have to go a little more farther to reach that particular numbers. Okay? So wish you all the very best. Please carry this communication and compassion with you and learn computers. And this is what I want to just convey. And as everyone will speak about the significance of lamp lighting and Florence Nightingale, we will be reading that though Florence Nightingale was a pioneer and she was a lady with a lamp, please follow the compassionate heart. Because of that only she is even being praised in this world. Okay? Thank you all.